What's up, YouTube? Because you guys stuck around through last week's hiccup, we are here today with the diagnosis video. Hey, party! In case you don't remember where we left off, he said something is something on your MRI, something. If you were my daughter, I would send you to the Cleveland Clinic. So from that point forward, we started packing up our stuff and driving from Burton, Michigan down to Cleveland, Ohio to visit the Mellon Center at the Cleveland Clinic because they're known for MS. It's just a thing. When you want the best treatment, you typically go to the place that has really, really smart people. If you are at this stage of your MS, you could expect any sort of combination of tests. You have physical tests, MRIs, Spinal Tap. I had an EEG, and then there are lots and lots of questions coming your way. The physical test is pretty basic. I do this and then this every month, and then this, and then stop and this, and then you do the drunk test, which hopefully I never get pulled over and have to flash my MS card. That doesn't exist. You also have this test where you have to put your feet together and you stick your arms straight out and you close your eyes, and when I'm standing up I tend to go one way or the other. I can't just stand up straight. It's really, really interesting if you think about it, because when I walk, especially up and down stairs, I do look down. I look to see where my feet are going next, just because it helps with the communication. I don't know. They also test your speed. Your doctor might not, but my doctor, you have to start at this line and go to that line, and he tests how quickly you can walk in between those two markers. MRIs are pretty basic. You have no contrast and contrast in a brain and a spine, depending on where your lesions are. I know there's a technical terminology for this, but if you have active lesions, the contrast sort of gets sucked up into them and makes them glow, makes them whiter, makes them brighter, makes them just more apparent on the scan, which is why I encourage you to ask your doctor to see your scans if you don't already get to. It's kind of cool to just cope with. You can see, oh, you little bugger, you're the reason I can't walk in a straight line, or you're the reason I have bowel problems. I hate you. Next up, you have a spinal tap. Spinal taps are scary. Like, who wants a spinal tap? It's a needle in your spinal cord, and that's just not fun. During my spinal tap, I was so high. They had to give me Valium because it was just, I was terrified of needles, and I was gonna freak out on them if I really, really had to do this. Like, oh, and I probably shouldn't say high. High is not a positive word. That's a negative word. But I was loopy. I had to sit up. They said I was too skinny, and they wanted to a different position because they couldn't get it in, which is not fun when, you know, they keep trying to stick a needle in your spine. Not fun at all. I sat up and stuck my head down on the wall, and they did it, and then I donated some of my juices to a study, and that's just what you do. The EEG, I'm not sure if that's a standard MS test because it's not for MS, it's for epilepsy, but they hooked me up with these electrodes in my hair with this really, really yucky paste, and I had to watch a screen and watch the stuff, something about right brain, left brain, and transmitting signals. Once all of the poking and prodding was over, it was time to sit down with the doctor. My mom and Brad, they were sitting right here, and I was here, and the doctor comes in, and I remember she pushed this cart over in front of me, like a little tray table, and just plopped my test results down. I really appreciated that because it helped process. You know, It's like the man on the moon thing. Did we really go there? Do I really have MS? What did my test results say? Are you lying to me? Really, no, I don't have MS. I don't want it, so I don't have it. Like, those are legitimate thoughts, especially the man on the moon one. And then it was time for treatment options. Now, she started with the crab injections because those are safe and easy. You know, there's Copaxone and Rebeth, Avonex, and beta interferon. I think that's how you say it. And then she moved on to some sort of infusion that's sort of like chemo, but not chemo because it's not as strong. And I'm like, no, not even a chance. I'm sorry. That does not sound like fun. And injections, no thank you. And then we talked about Tysabri. Hello, Tysabri. Yes, please. I was 19. She used the word aggressive in the description. That was what I wanted. Even though I summed up my month and a half journey in about 5 minutes, it isn't a walk in the park. It isn't that quick. It isn't as easy as I probably made it sound. It is exhausting. So exhausting. And I think if I had to pick, it is probably the most fuzzy of this time period because there was so much going on. I was bad. I was bad at this point. And then I'm going through the overwhelming diagnosis thing. So please research. Please trust your caregiver. Please be your own advocate. Do that for yourself. Do that for me. If the doctor says a test comes back negative, please ask them, well, okay, what's the next test? There has to be something else. This can't be the final answer. Please continue to leave your stories in the comments below. Encouragement, anything. Just let me know what's going through your head. If you don't feel comfortable with it being public, please send it in a message. Use this awkward, awesome head of MS stuff to help you. Use me. That's what I'm here for, to use and abuse. I'll catch you guys next week. Bye.